morning world. Namaskar. This is Sayantan from Kolkata, West Bengal, India. We are here to discuss about who should get the coronavirus vaccine first. We are a very different country. We are a very different region. The Southeast Asian region, the Indian subcontinent, is a densely crowded population. This is a region with immense density of population, and people were struggling last few months of the pandemic for their livelihood. And here we can see that so many people are out in the streets. Hardly anybody is being able to maintain the social distances and wearing the masks, making the situation very different and very difficult for our country to manage. Our situation is very different from the global north and the global west and the developed countries. The government has recommended a total of 1 crore, that is 10 million healthcare workers, 2 crore, that is 20 million frontline workers, and 27 crore, that is 270 million people at risk who are above 50 years of age or younger population with comorbidities as a priority list of vaccination for India. The list is being prepared across the world, but in the list of the frontline workers, we have seen that the government has included the police, the armed forces, the municipality workers. But what about our market vendors? What about our fruit and vegetable vendors? Many of them among these groups are elderly population. Many of them are diabetic, many of them are hypertensive, and they work in an immensely densely crowded area. And this group is the supplier of food and vegetables for our dining table. So I believe that out of the frontline workers, the vegetable vendors and the market vendors who are under the shade of the lamp, who are under the darkness of the priority list that we are preparing, should be included in the priority list as one of the important groups. Enumeration of this large number of workers working in the unorganized sector is very difficult for the government. Here we need the involvement of the community-based organizations, of the non-government organizations, and the trade unions who are working closely with these market vendors. We have a large number of young hypertensives and young diabetics in our country, and many of them are working in this kind of environment. So for the preparation of the priority list of the COVID-19 vaccination, we need to involve the ground people, we need to involve the trade unions, community-based organizations, and non-government organizations who work closely with all the population here and similar kind of densely populated, unorganized sector workers.
আমরা কি গরিব মানুষ, আমরা কি টাকা দিয়ে ভ্যাকসিন নিতে পারবো বলো? আমরা তো গরিব, আমরা এইসব ঘুরিয়ে আমাদের সংসার।
Daily wage laborers who are in unorganized sectors like the rickshaw pullers, the cab drivers and the auto rickshaw drivers, many of them are elderly, many of them are smokers, many of them are heart and lung patients, many of them are suffering from many undiagnosed diseases and serious malignancies. We are hardly counting them in our priority list. We have to involve the trade unions and the community-based organizations who are working with these bus drivers and bus conductors and other transport services like the taxi drivers, the auto rickshaw drivers and the rickshaw pullers. And we have to prioritize these people into the list of our vaccination. We are in front of a very busy public hospital in Calcutta. Here we can see many patients with cancers, with heart disease, with lung disease, and young patients with severe malignancies and other diseases are coming and crowding for getting treatment in the public hospitals. We need to ensure that we do not create an extra queue for the vaccination for COVID-19. We need to see that these people with comorbidities are actually counted from the hospitals where they have come to take their services. We need to ensure that the 27 crore population with over the 50 years of age and less than 50 years of age with comorbidities that the government is preparing must include the people who are there coming to the public hospitals with significant comorbidities in the priority list of vaccination. We have to remember that the healthcare workers does not only mean the doctors and nurses who are working in the public or private hospitals. The healthcare workers also mean the contractualized and non-governmentally employed Safai Karmcharis, or the housekeeping workers, and the security workers as well, the Group D staff, the general duty assistants as well. After the advent of globalization, there has been immense privatization and contractual recruitment of these group of people, and they are often not counted when we actually count the number of healthcare workers for various benefits and other purposes. Shialda station in Kolkata is one of the busiest railway stations across the world. The station was closed for about 8 to 9 months because of this COVID-19 pandemic. Now we have opened up our public transport system, and we can see so many people, many of them are elderly and we don't know what comorbidities they have. People are traveling in this public transport system of suburban railways. So we need to prepare the list at the community level, at the level of where people are actually walking. I absolutely appreciate the effort of the Government of India and the federal state governments, but we need to involve more and more people who belong to the community. We need to involve more and more people who are working closely with this population. Countrywide lockdown was enforced from the 23rd of March, and we have been observing lockdown for almost 7 months after that. Now we are in a phase of lifting the lockdown. Lockdown has been massively unsuccessful in the slums and the densely populated lower income group residential clusters. During the lockdown period, people living in the slums, which are highly densely crowded, has not been able to maintain the social distancing. It is immensely difficult to maintain personal hygiene, hand washing, hand sanitization and social distancing in the slums. This is the area where not only COVID-19 but also influenza and all other easily transmissible diseases, airborne diseases, droplet infections spread very rapidly. So these are the areas where elderly people, people living with comorbidities, people with hypertension, people with lung diseases has to be enlisted in the priority list of vaccination. These are the areas where people do not have access to clean liquid petroleum gas for cooking. These are the areas which has a very high degree of indoor as well as outdoor air pollution because they use the fossil fuels for regular cooking purpose. So these areas also have a very high incidence of chronic obstructive pulmonary disease and other lung diseases. So we have to involve the community-based organizations, the non-government organizations and the people living in the slums to prepare the priority list of vaccination. We need to prepare the list by the people in the community. We need to involve the leaders of the community, the people living in the slum community, the organizations working closely in the slum community. This list cannot be prepared from the ivory towers of the government. This list has to be prepared in the ground by the people, for the people.